The World Health Organization has changed its stance on massive lockdowns. But does that mean lockdowns are over? Welcome to America Uncovered. I'm Chris Chappell. During the coronavirus outbreak this year, governors across America have implemented various degrees of lockdown in different states, telling people to stay in their homes. Some cities have even threatened fines of up to $500 or 90 days in jail for violating the lockdown. A lot of businesses are closed. So are many restaurants and schools. And while that may seem a bit harsh, keep in mind, it's because everyone's collective safety is the most important thing. And the World Health Organization told us that lockdowns are an important measure for everyone's safety, which sounds perfectly reasonable. After all, the Chinese Communist Party put 58 million people into lockdown. And if people didn't comply, authorities made them comply. The World Health Organization praised China for its effective measures that helped limit the global spread of coronavirus. Now you might be thinking, wait, China's lockdowns didn't actually limit the global spread of the coronavirus. That's why the coronavirus is spreading across the globe. And if you're thinking that, stop thinking. Because China said lockdowns work. And then the WHO agreed with China. And then it seemed every other country also thought lockdowns were a good idea. Except Sweden. But what do they know? They're full of meatballs. No, Seamus, you know what I meant. Delicious, delicious IKEA meatballs that you can't eat because the IKEA restaurant is closed because of the coronavirus. But anyway, for more than half a year, the WHO encouraged lockdowns worldwide as one of the primary ways to limit the spread of the coronavirus. And when the coronavirus began to spike again, the WHO told countries they may have to reinstate lockdowns. Coronavirus lockdowns work, people. Follow the science. Except this week, the WHO said that maybe lockdowns weren't actually the best idea. Take it away, Dr. David Nabarro from the World Health Organization.
We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus. The only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted. But by and large, we'd rather not do it.
Whoopsie daisy. Sorry everyone in the world who's been under lockdown for most of 2020 because we encouraged it. Now if you're wondering why the WHO has backflipped on its coronavirus stance by condemning lockdowns, well, now they're saying they haven't actually backflipped. See, WHO spokesperson Dr. Margaret Harris said it is not a backflip. It is not a change in advice. Okay then. Explain it to me, Dr. Harris. Lockdowns are basically mass quarantines, and governments have got to the stage where they have huge transmission going on, and it's not exactly clear where the chains of transmission are. It is a thing that governments have resorted to. Okay. That's less clear. We know governments have resorted to lockdowns, but are lockdowns the right approach? We say don't just do one thing. Don't just rely on your border closure or your mass quarantine. Do absolutely everything you can. When people come out of lockdowns, they think, okay, it is over. We don't have to do all of the other things anymore. And in fact, it is all the other things that really work. What is she talking about? We've all been wearing masks for the last 6 months. Dr. Harris seems to be saying that the WHO didn't say that countries should only do lockdowns, which is true, but they definitely encouraged lockdowns. For example, warning about a deadly resurgence if lockdowns were lifted too early. So the WHO is now saying that lockdowns should not be used as the primary method of controlling the coronavirus. They're saying there are lots of other methods that are actually more effective, like social distancing, staying away from large indoor gatherings, and washing your hands frequently. The WHO also says everyone should wear a mask in public, even though earlier they had said healthy people don't need to. The science on that one officially changed in early June. But the WHO's change on lockdowns is a much more serious issue. The consequence of wearing a mask all the time is that it's very annoying. But the consequence of a massive lockdown has been like taking a wrecking ball to our economy. And, as we talked about in an episode 2 weeks ago, lockdowns in America have made the rich richer and the poor poorer. And I guess the WHO agrees with us on that issue.
Lockdowns just have one consequence that you must never, ever belittle, and that is making poor people an awful lot poorer.
Between blue-collar workers who've lost their jobs and millions of parents who have had to stay home and take care of their kids who can't go to school, and the loss of countless small businesses, lockdowns have been an economic disaster. So now that the WHO is saying lockdowns should not be the primary way to fight the coronavirus, will the U.S. actually stop locking people down? Well, like many things in America, it depends more on politics than science. And I'll tell you why after the break. Welcome back. So, how long do we have to stay in partial lockdown after the WHO says lockdowns should not be the primary way to stop the coronavirus? That depends more on politics than science. For example, after restaurant owners in New York sued the government for not allowing them to open indoor dining, there was political pressure to allow restaurants to reopen indoor dining, even though it means people will be sitting around together indoors without masks. On the other hand, when teachers' unions sued their governors to block in-person school instruction, there has been political pressure to keep schools closed, even though kids are less prone to coronavirus infection than adults. Take that, science. And there's another factor. Donald Trump.
It's your favorite president?
So you know how, for months, President Trump has criticized coronavirus lockdowns, and the media have criticized him for that. Well, I bet President Trump feels vindicated. He tweeted on Monday that the World Health Organization just admitted that I was right. Which, okay, the World Health Organization did not actually say Trump was right. I guarantee you that is something the WHO would never actually say. Trump is not their favorite president. But the WHO did just say lockdowns should not be the primary way to fight the coronavirus, and that lockdowns have too great an economic cost. That is essentially what Trump has been saying. Although the WHO is not saying that everything should immediately be opened up. Dr. Nabarro, who made the recent statements about lockdowns, advocates what he calls the middle path. That is, people should take precautions and governments should increase their testing capacity to identify hotspots. From time to time, it will be necessary briefly to restrict movement locally to enable suppression of outbreaks. But too many restrictions damage people's livelihoods and provoke resentment. What? Resentment? That's crazy. A similar concern was brought up by a group of prominent scientists this month in the Great Barrington Declaration. Disease experts, coming from both the left and right and around the world, published this declaration. It says, current lockdown policies are producing devastating effects on short and long-term public health. The results include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health. Boy, can I relate to that one. Leading to greater excess mortality in years to come, with the working class and younger members of society carrying the heaviest burden. Instead, these scientists advocate for what they called focused protection. They go further than the WHO in calling for normal life to pretty much resume, except for people especially vulnerable to the coronavirus. They say that protecting the vulnerable should be the focus of coronavirus health policy, and that the overall goal should be to minimize mortality and social harm until we reach herd immunity. Okay, I can see how talking about herd immunity is controversial, but surely we can have a nuanced conversation about the pros and cons of these ideas. Just kidding. Let's make this about politics. But there is now a more mainstream conversation about the idea that lockdowns can do more harm than good. Whereas if you said that 3 months ago, you would be called a grandma killer. But what will this actually mean in terms of policy? Will state governors in the US end overly restrictive lockdowns? Again, this probably depends more on politics than on science. Democratic politicians like to blame Trump for handling the coronavirus badly. Republican politicians like to blame Democratic governors for excessive lockdowns. And what about the media? Well, so far they seem to be mostly ignoring the WHO statement, or making it about politics. This Newsweek article asks if the WHO now agrees with Donald Trump. They gave it a rating of mostly false. They're not saying Trump was wrong about lockdowns, they're saying his tweet was mostly false because the WHO did not explicitly admit Trump was right. I'd rate their mostly false rating mostly false. But hopefully this will all go away after the election 3 weeks from now. The media will be so excited about President-elect Biden that they'll stop reporting on the coronavirus and things will all go back to normal. If they can. I barely remember how to hug people anymore. Or Trump will win the election. And then we'll be stuck in the same media dumpster fire for another 4 years. I can't wait to see what happens. What do you think? Leave your comments below. And if you like this show, please support America Uncovered with $1 or more per episode. Visit patreon.com/America Uncovered to learn how you can help us keep making great videos. Once again, I'm Chris Chappell. See you next time.